shine me nationality brighter. I am a soul warrior.
7:19 in Trinidad and Tobago. You know, we talk about bittersweet, about, you know, highlighting issues and then the media responding and so on. When you hear Maximus Dan Soca Warrior, it brings back bittersweet memories of the sweet is qualifying for the World Cup, going to the World Cup, but the bitter is what happened afterwards. The blacklisting of players, how the standard of football dived, how we lost to Grenada, we lost to Guyana, we couldn't get far in World Cup qualification, how football was in a mess for so long. We always seem to mess things up in a certain way. But let's see how things go this evening in the final phase of qualification. The opening game of that final phase against Costa Rica. Kickoff is at 7 o'clock at the Hazley Crawford Stadium. Talking about kickoff, the Ministry of Health, they've kicked off a vaccination drive for what they're describing as the 2016-2017 flu season. And you know there's a piece of bacchanal by itself already. However, there are special health centers which will offer flu vaccines to special vulnerable groups every Tuesday and Thursday from 8 a.m. to 4 p.m. Those vulnerable groups include children aged 6 months to 2 years, pregnant women, adults over 65, people with chronic medical conditions, that's heart, lung, or kidney disease and diabetes, obese individuals as well. Well, that's just part of the information, and someone who's very well qualified to give us some more information on this initiative. We're joined by the County Medical Officer of Health, Dr. Maryam Richards. Thanks very much for joining us, Doc. Good to have you on the show with us once again. Not that I want to get you in the bacchanal, but do we actually have what they call it a flu season, but a time of the year that the data shows that people are more susceptible to the flu and flu virus types of illnesses?
Well, the term flu season was really coined in the temperate countries where persons with the seasonal changes and so would develop or would acquire the influenza virus and have serious complications. Locally, what we've noted is that our casualties tend to be around this time in the year. And given that the new flu vaccine is produced on or around August of every year and distributed by October of each year to our country and our region, we thought that it was imperative to start an immediate vaccination drive and attempt to vaccinate as many persons in the vulnerable group that we can possibly do.
Do the vaccines work, and are there side effects? Should we be wary of potential consequences to certain people with maybe certain illnesses about the vaccine?
The Centers for Disease Control out of the United States have really endorsed and recommended that vaccination should be done on all high-risk or vulnerable groups. Of course, as with any intervention, medical intervention, there are side effects. However, the benefits of vaccination overall to the population greatly outweigh the risk. When we speak about the side effects, there are minor and short-term side effects, and they are very rare, and I have to stress very rare, meaning 1 in 1 million in terms of serious side effects. And the common or the very minor side effects would be side effects related to the actual vaccination process, such as redness on your arm or an allergic reaction or pain or swelling, which is, as I said, related just to giving someone a vaccination. It would be the same for a chickenpox vaccine or a measles vaccine. And the other set of side effects would really relate to the contents of the vaccine, where persons may have a very, very mild sort of flu-like symptom. Now, although you may develop these sorts of side effects, we must consider that having the vaccine actually prevents you from developing the more serious complications of the influenza virus, which could result in hospitalization and in some cases death. Last year we had 90 confirmed cases of the influenza virus, and we had 8 deaths, 2 of which were in pregnant patients. So we really want to raise the awareness of the vaccination amongst our pregnant women and really encourage them to go out there and get the vaccine.
And before we talk about, repeat the information about the vaccine and the way it's available, when it's available, yes, what are the times and so on. Are we, just so I can understand clearly, and I suppose the viewers as well, if you take this vaccine, does it mean you wouldn't catch cold anymore, that you wouldn't get the common flu and that sort of thing?
You won't get the serious strains of the common flu. When we think about the flu, there are several viruses that cause the flu. The ones we are really concerned about would be the strains like the H1N1, which we refer to as swine flu.
Yeah.
Now, you can still get a very mild flu, which does not have severe consequences, but your likelihood and the potential of you developing the H1N1 and also the likelihood of you having a flu that will basically become very serious, resulting in your hospitalization and side effects, is greatly diminished.
So just remind us again. So the availability of the vaccines and the drive, it has started already?
Yes. The Ministry of Health has embarked on a very proactive mass immunization campaign, and the Honorable Minister himself has taken the lead on this campaign. And we have the vaccines available at our local health centers on a Tuesday and Thursday between 8 a.m. and 4 p.m. The actual health centers would be listed on the Ministry of Health website. So we have contact phone numbers for the health centers. We also have contact information on the county medical officers of health who are responsible for the particular health centers in each county. If, for example, a member of the population has any challenges or requires any further information on vaccination.
And are you prioritizing these vulnerable groups that we've talked about, or is it a first come, first serve sort of thing for the vaccine?
Well, we are trying to prioritize the vulnerable groups that we spoke about. To my knowledge, the current international evidence suggests that if we vaccinate about 10% of our population and prioritize our high-risk groups, which you indicated earlier, there should be sufficient coverage to prevent the severe consequences of the vaccine. That being said, if someone shows up at a health center and they are interested in the vaccine and they may not fall into one of these high-risk groups, we do ask the staff there to exercise discretion because they have made an effort to attend and to come there.
But are you concerned that if people, whether for reasons of excessive caution, if they don't fall into these categories but they want to get the vaccine, that it could affect the availability for those who actually fall into those vulnerable groups?
Well, the Ministry of Health procured 100,000 vaccines as of present, and depending on the uptake and how quickly the resources are being used, further orders can be made.
Is it too early to say how people have responded so far? What's the information that you've been getting in relation to that?
Well, the actual vaccination drive really kicked off over the last 2 weeks, and we are seeing significant increases in vaccinations. We really want to encourage and recommend that pregnant women come out and get vaccinated. During pregnancy, the risk of influenza virus transmission is increased because of changes in the immune system and the risk of complications during pregnancy and those causing preterm labor and injury to a newborn or to the unborn baby really increases. So we want to really encourage that group in particular, as well as those mothers with young children between the ages of 6 months to 2 years, and the elderly, persons above 65 years, and persons with chronic medical conditions such as diabetes and hypertension.
And as we talk about viruses and influenza and different strains, because again, with my limited understanding, there are always different strains, different types that develop, that recur after 10, 20, 30 years and so on. Does that present a challenge as far as monitoring and detecting? Of course, there is international collaboration. Does that mean that the flu virus itself has to be upgraded, has to be adapted to suit changing circumstances?
Well, that's an excellent question. And what the manufacturers themselves really look at an ongoing process in terms of the evolution of this virus. The influenza vaccine actually mutates quite rapidly, and that's why the vaccine needs to be updated annually. And we are very fortunate in Trinidad and Tobago because, together with the assistance of the Pan American Health Organization, the Ministry of Health is able to procure vaccines and to have them delivered to Trinidad and Tobago in a very short space of time from the time they're available from the manufacturers. So, as I said, we do have a stock of 100,000 vaccines of the new strain that has been adapted to the new strain available for disbursement.
All right. Before we conclude, so let's just remind you again that there are a number of special health centers identified where the vaccines will be available Tuesday and Thursday of the week from 8 a.m. to 4 p.m. And again, the vulnerable groups, children aged 6 months to 2 years, pregnant women, adults over 65, persons with chronic medical conditions, that's heart, lung, or kidney disease or diabetes, and obese individuals as well. And finally, Doctor, if you could just give the website again for those who would like to get any further information or just general guidance on either this particular initiative or any general information.
The Ministry of Health's website, www.health.gov.tt, has current information on the county medical officers of health, who are the persons responsible for the health centers, as well as a listing of all the health centers in your particular county or area, that has the vaccine available from 8 a.m. to 4 p.m. on a Tuesday and Thursday. For further information, you are free to contact your relevant County Medical Officer of Health Office or to check your current health center on listing. In closing, I would like the population to start being a little bit influential, as we would say, because we really need to encourage those amongst us who are at risk of developing serious strains of the influenza vaccine to have their vaccines.
Yes, basically, be influential on influenza, essentially, Dr. Richards.
Thank you so much
very much for coming in this morning to give us this important information. So whether you want to debate the issue not about flu season or not, the fact is you need to as best as possible, to protect yourself if you do fall into those vulnerable categories. Coming up towards 7:29 in Trinidad and Tobago. We'll be back right after this, moving into the last half an hour of Morning Edition.
Nationality.